Welcome to Beforeplay, Not Afterthought, the podcast that puts sexual health right at the start of conversations. I'm your host, and today we're diving into a topic that is incredibly important for many of us: syphilis, sexually transmitted infections, STIs, and the crucial necessity for regular testing. This episode is particularly relevant for younger audiences and the LGBTQIA community who need to stay informed and proactive about their sexual health.
You might have noticed some eye-catching campaigns lately urging people to make STI testing your before play. These campaigns are in direct response to a concerning trend: rising STI rates in Australia. Did you know that 1 in 6 Australians is expected to have an STI at some point in their lives? That's a significant statistic that demands our attention.
That's right. It's essential we normalize the concept of regular STI testing rather than it being something people only think about when they notice symptoms or feel something is wrong. It's all about making sexual health, including testing, a routine part of our lives, just like a regular checkup at your doctor's office.
Today, we'll start by discussing what syphilis is. Syphilis is a bacterial STI that spreads primarily through sexual contact. It can have long-term health consequences if left untreated, including severe complications that could impact your overall health and even cause disability or death. Isn't that alarming?
It truly is. One of the tricky aspects of syphilis is that many people might not exhibit obvious symptoms. A painless sore, rash, or flu-like symptoms can go unnoticed. This underlines just how crucial regular testing is. We can't rely solely on symptoms to alert us to the potential presence of an STI.
Correct. Exchanging stories or chatting about testing should not feel like taboo. It's particularly important in LGBTQIA communities where there is often a heightened risk of STIs. Regular health checkups foster a sense of visibility and empowerment, allowing conversations about sexual health to be openly discussed and sending the message that taking care of your sexual health is both responsible and cool.
And let's not forget about the rising rates of other STIs, like chlamydia and gonorrhea. These infections are typically easy to treat with antibiotics when detected early. Nevertheless, much like syphilis, many people do not show symptoms, allowing these infections to spread unnoticed. We need to expand our understanding of what it means to manage our sexual health proactively.
Absolutely. There's a misconception that STIs signify poor hygiene or irresponsible behavior, but that couldn't be further from the truth. STIs can affect anyone who is sexually active. It's vital we break down these stigmas because they create unnecessary barriers to seeking the help and testing people need.
You mentioned breaking down stigma. That's crucial. One way to counter stigma is to have conversations around testing and safety practices, such as using protection. When we normalize these discussions, we empower not just ourselves, but others in our community too.
Definitely. So, shifting gears a bit to the practical side, how often should someone get tested? Current guidelines recommend testing every 3 to 6 months if you're sexually active, especially if you have new or multiple partners. It's important to assess your personal risk and have that discussion with a healthcare professional.
That's a great point. And for those who might feel anxiety around the thought of getting tested, it's worth noting that many clinics offer a friendly, non-judgmental space and may even allow friends or partners to accompany you for support. Many LGBTQIA+ and community-led clinics focus heavily on creating safe spaces.
In fact, some health services have even adopted online or telehealth options for arranging tests. How convenient is that? You can often get a test with a simple urine sample, blood test, or swab without needing to visit a clinic. This makes testing much more accessible for everyone.
Now, let's talk seriously about what happens during a test. Many people worry about the stigma of being in a clinic. Equip yourself with some knowledge. Recognize that these professionals are trained to help you in a non-judgmental way. They want to catch potential infections early to stay proactive. It's their job, and they certainly don't want to see you in a worse state later on due to complications.
For sure. And if people feel nervous about initiating these conversations, they could use a simple script to ease in. I'm due for a regular STI checkup. When did you last get tested? It makes the conversation feel more collaborative rather than transactional. It also positions testing as a shared responsibility rather than a singular concern.
That's a perfect strategy. By treating sexual health as an essential part of your overall well being, it helps strip away the negative narrative surrounding STIs. Also, remember, a conversation should happen before you swipe, flirt, or hook up. Use protection whenever possible. It's always better to be safe than sorry.
I couldn't agree more. And let's delve deeper into another preventative measure, PrEP, pre-exposure prophylaxis. This medication can greatly reduce one's risk of contracting HIV, yet regular testing still remains critical for monitoring other STIs. We can't ignore the interconnectedness of our sexual health, even with advancements like PrEP.
Exactly. So, taking one small step to address your sexual health this week could involve booking a screening for yourself or initiating that talk with someone you care about. If anything we've discussed today has raised questions for you, don't hesitate to reach out to trusted sources or healthcare professionals for the right answers.
Right, your sexual health is vital, and being proactive means you are taking care of your future and your partners. Remember, we all play a role in promoting a healthier community. Thanks for tuning in to today's episode. Together, we can ensure that sexual health comes first in our conversations, not an afterthought.
And as always, keep the lines of communication open. Discuss what you've learned today, have those candid conversations about sexual health, and let's reduce stigma. Stay safe and take care of yourselves and your communities. Until next time.
Take care, everyone, and remember, make STI testing part of your Beforeplay.